I'm Kenneth Cutbush, an orthopaedic shoulder surgeon working in Brisbane. I'm with Lucy Angelini, a shoulder physio, and we're talking about distal bicep tendon reconstruction. So if you've ruptured your distal bicep, so that's the bicep tendon at the elbow, we're talking about the rehab that you're going to be facing if you're considering having surgery. Generally, if you've ruptured your distal bicep, you'll be planning on having surgery. Although some people only have a partial tear and they've got pain and discomfort, so that might be a different consideration. The operation, you'll have an open incision here at the elbow. If you've got a chronic distal bicep tendon rupture and it's curled right up into the arm, you may get a second incision here so we can retrieve the tendon and feed it down to where it needs to go. It's fixed with a little button down there. You'll be in a sling after the operation. If it's a chronic one and it's been a while since it's ruptured, you might be quite tight in your elbow flexion, might be right up here, but generally not. Generally be down. You'll be in a sling and you'll be on the ward for one night, and the next morning the nurse will check your dressings, and the physio will see you. The physio will take down your bandage and the nurse will check the dressings. So Lucy, what is the physio going to do with them before they leave hospital?
Yeah, so often, yes, we take down the dressing and we might put some tubey grip on because it's often a little bit swollen. And then we'll show you some range of motion exercises to make sure that the adjacent joints don't stiffen up as a result of being in a sling. So we make sure that you're moving your hand and your neck and your shoulder. And then we teach you how to move the elbow. So we're trying to obviously protect the biceps repair. So we're not actively contracting the biceps. All the elbow movements have to be passive. And so you'll be taught how to use your other hand to move the elbow and to supinate the wrist. So that has to be passive, but your physio will go through that with you. And the sling will be fit properly, so making sure that you've got good scapular posture in the sling. And you'll be taught how to shower and how to put on a shirt and also how to take the sling on and off yourself.
Yeah, and the sling, it won't have a bolster, it'll just be a straightforward sling. And it's important that I guess here to talk about active and passive movement, isn't it? So a passive movement in terms of rehab is a movement where you're either lifting your arm yourself or someone else is lifting your arm. Whereas an active movement is when you're actually doing it yourself under your own power. And what we don't want is active elbow flexion. That's the big one. You don't want you lifting. We don't want you contracting that bicep muscle because it will pull on the repair and possibly stretch up the repair or even pull the repair apart if you're too rough with it. And I have seen that. I have seen someone pull a handbrake on at 6 weeks and pull their distal bicep repair apart. And you do need to go very slowly for the first 3 months and let it heal up. You'll be in a sling full time for 6 weeks. Between 6 and 12 weeks, we'll be going very slow with it. And we won't be doing much at all until 3 months down the track. Now, when do they first see their physio?
So normally you can go and see your physio around the 2-week mark just to have a look at your wound, make sure it all looks okay, and to go over your exercises and make sure that you're good with the precautions because they're pretty important. Something that some patients often experience is a little bit of tingling or numbness sort of down through their thumb, which is all very normal. Yeah. So your physio can reassure you of that. And just, at 2 weeks, making sure life in the sling's going okay. But nothing new is really added.
Yeah. And then we will see for the first visit at 6 weeks. What's going to happen at the 6-week visit?
So at 6 weeks you can come out of the sling, which is exciting, and we encourage light use with your arm. So we want you to start using your arm for all your light day-to-day activities. So start using it to eat and to wash and to dress and to groom, all those kinds of things. We just don't want anything of any significant weight in your hand yet, so nothing more than about 0.5 kilo. A cup of tea. So you're not lifting it, but you're moving it.
Yeah. And then we see them back at 12 weeks?
Yes.
What's going to happen at 12 weeks?
At 12 weeks, it's good we get to start some strengthening of the biceps. So it's healed enough for us now to add some load to it. And we just make sure that we do it in a very graduated fashion. It'll be nice and weak because it's had 3 months off. So it's good to get it nice and strong again. And oftentimes the rest of your, shoulder girdle's a bit weak too because you haven't been using it normally. So we start strengthening of the rotator cuff and scapular stabilizers and start planning timeframes in terms of returning to the activities that you want to get back to.
So the big thing is no maximal lift before 6 months.
Exactly. So we've got 3 months from month 3 to month 6 to gradually build your strength. So we don't want it strong tomorrow. We've got 3 months to get
Yeah.
there. Yeah.
And normally it's around 6 months. It's all done, isn't it? 6 months of rehab.
Yep, absolutely. Yeah. Back at the gym. Yes, doing all the normal things.
So if you have ruptured your bicep tendon at the elbow, that's an overview of the rehab, what you'll need to think about you're going to go through after the surgery. Thank you for listening.